Hi and welcome back to CareSync Experts. Running a domiciliary care service in the UK comes with its unique set of challenges. In this video, we'll take a look at the top 5 issues care providers face and how you can overcome them to ensure your business not only survives, but thrives. Challenge number 1, recruitment and retention. Recruitment and retention are some of the biggest struggles in the care industry, with over 85% of care providers reporting recruitment challenges. Finding and keeping quality staff is a major concern. So what are some of the problems? The first is high vacancy rates. With a 13% vacancy rate in social care, providers face tough competition to attract and retain staff. So how can we solve this? The first option is competitive wages. Pay staff a competitive wage to stand out in the marketplace. For example, you could pay staff £12.50 per hour whilst charging your clients £25 per hour. This ensures you remain competitive while covering your business cost. The second option is flexible working hours. Offering flexible working hours can attract wider talent pools, including those balancing caregiving or parenting. And lastly, career development. Provide career development opportunities to boost staff engagement and retention. Upskilling staff for specializations such as dementia care creates a pathway for growth. Challenge number 2, navigating regulatory compliance. Navigating CQC compliance is an essential but often time-consuming task. Ensuring that your business meets all regulatory standards can be overwhelming for any provider. So one of the biggest problems with this is that this is time-intensive. Manual compliance tasks, including documentation and audits, can take away valuable time from client care. So how could we solve this? Try using compliance management softwares. Use digital tools such as Roundsys, Birdie, and Log My Care to automate compliance reporting, care plan updates, and real-time documentation. This allows your team to focus more on client care while staying on top of regulatory requirements. Additionally, try internal audits. Regularly perform internal audits and mock inspections to ensure compliance readiness at all times. Challenge number 3, financial sustainability. Maintaining financial sustainability while delivering high-quality care can be a tight balancing act, especially when local authority funding is insufficient. So, what are some of the problems? Insufficient local authority payments. Many local authorities pay significantly less than the true cost of providing care, making it hard for providers to stay afloat. So, how can we solve this? If you're working with private clients or under a framework that pays you £25 per hour, here's how you can structure your costs while still breaking even and making a profit. Start off by paying your staff £12.50 per hour. This ensures that you're offering competitive wages while staying within budget. Number 2, wage-related costs. Add 13.8% for national insurance contributions, 3% for pension, and 12.07% for holiday pay. These costs add up to approximately £3.67 per hour. So what would the total wage cost be? So £12.50 plus £3.67 equals £16.17 per hour. And then filter in your operational costs. Operational overheads typically range around 25% of the hourly charge. This includes admin, insurance, training, and compliance costs. So £25 times 25% equals £6.25 per hour for operational costs. So, after taking all of this into consideration, what is your remaining profit? After paying staff and covering operational costs, you should be left with £25, then minus £16.17, and again minus £6.25, which leaves you with £2.58 per hour in profit, or about 10% profit margin. This structure allows you to pay your staff competitively, meet all overhead costs, and still make a profit. And lastly, automation. Using automated billing and payroll systems can reduce errors and improve cash flow. We're aware that all providers aren't always receiving £25 per hour. So, when you're being paid a low hourly rate, increasing your profit margin requires creativity and operational efficiency. Here's how to enhance your profitability even when the rates are low. First, target the private market. To offset the lower rates from local authorities, you can target the private pay market, where higher rates are more feasible and private clients are often willing to pay more for personalised and high-quality care. Firstly, try marketing strategies. Use the marketing tactics outlined in our previous videos. These include SEO-optimized websites. Ensure your website ranks high for local care-related search terms, showcasing your quality of service and client testimonials. Next, Google Ads and social media campaigns. Run targeted digital ads aimed at families searching for care options for their loved ones. And lastly, networking in the local community. Build relationships with healthcare providers, hospitals, and social workers to generate referrals from people who need home care. Challenge number 4, client acquisition and retention. In a competitive market, attracting and retaining clients is key to your success. With increasing competitions, clients expect personalized, responsive care. So, what are some of the problems? High expectations. Families expect care to be timely, personalized, and transparent. Any missteps can lead to dissatisfaction. So, how can we solve this? Try creating personalized care packages. Tailor care plans to individual clients, ensuring that their unique needs are met. Regularly review and update these care plans as needs change. Next, client feedback systems. Use client feedback to continuously improve your service delivery. And lastly, communication apps. Use care management apps that allow clients and their families to track care schedules, receive updates, and communicate with caregivers where necessary. And lastly, challenge number 5, ensuring high quality care amidst growing demand. As demand for home care services rises, ensuring that the quality of care remains high becomes increasingly challenging. So, what are some of the problems? The first being overworked staff. With growing client lists, caregivers may feel overworked, leading to burnout and reduced care quality. So, how can you solve this? Try smart scheduling. Implement digital scheduling systems that ensures adequate time between client visits, preventing rushed care. And next, well-being programs. Provide wellness programs to support your staff's mental and physical health, reducing burnout. And lastly, real-time monitoring. Use real-time tracking tools to ensure caregivers are on schedule and delivering care as planned.